Hello, good evening everyone. This is Dr. Renata Vonko here. I hope you're all well. I came here today to give some advices on things that can be stopping you from healing. And I hope you can enjoy this video. I'm just gonna wait a little bit here to see if we can get some of you guys on the live and be participating on this video. I'm not really announcing, but I'm trying every Wednesday to have this lives and giving some tips and some things to clarify that unfortunately normal medicine doesn't let us know about it. So I would like to talk today about interference, some interference fields into our healing process, and what can be stopping us from the healing. And especially when we talk about chronic pains and inflammation, there is so many things hidden into our systems and to your pathways that end up disturbing our system and the path of the communications of the nerves, and mixing up with our brain. So I'm just gonna give a quickly example here. So imagine you're in a city, a big city like Dubai, where you pass by everywhere you can see lights. All the buildings are shining and beautiful. If you've been to New York especially, you can see all the buildings shining and the beautiful announcements, all lights everywhere. But imagine suddenly you're walking from these beautiful streets with these beautiful buildings, and suddenly you see a big blockage of light. So suddenly the area, let's say 100 meters, are without light. That will disturb completely the scenario, right? That we're gonna be they're gonna kind of disrupt the view, the beautiful view that you're having. So this happens to our nerve pathways. So imagine our body, our central nerve system, sending these beautiful lightning sparkling connections to our body, and then suddenly there is an area of darkness. And I'll tell you today what can be causing these areas of darkness. We need to do an inspection closer and see what is disrupting the view into our body. What is that causing this thing that our body keeps fighting, not resting? You spend, normally I ask the patients, how do you wake up in the morning? Are you waking up tired, or you wake up fresh? And a lot of the chronic patients will tell me, I wake up extremely tired. It's like I haven't slept. So that means your brain, your central nerve system, it's working at night very hard to fix things instead of regenerating things. So this is what happens with our nerve system when things are disrupted. So the nerve pathways are disrupted. So things I have a huge list here of things I can be talking about, as I love, I have so much content to give, but I'm gonna try to make onto simple things and to help you out. So I'm gonna start with tooth and root canal especially, and amalgam fillings. That is an extremely disruptive thing for our body. I'll never forget when I went to one of the conferences of KST in Philadelphia, and we had an amazing toxicologist from Korea talking about tooth and our health through our tooth. So his main request was for everyone who was attending the course to have the conference, to have a panoramic view of the and to get the whole jaw and the alignments and getting all the view, like the full panoramic and he will tell our health, his story, the story of our life health by our teeth. And it was funny because when I was in that conference, I suddenly broke one of my teeth. And funny enough, as he's talking about teeth, I was chewing some nuts. I was biting on some nuts, and one of my teeth broken. And when I went into the tooth chart of meridians, I figured out that that was tooth related to the pancreas. And everyone who knows me knows that I had some pancreas issue in the past. So very interesting. So in his opinion, we should not leave any root canal tooth in the body, because he says it's kind of like a dead tooth. However, I'm still studying that. I'm still because I think as well, once you remove, it's like the ghost line or energy into your system. So I'm still studying that. I'm still figuring out and talking to biodentists and see what is the other options. I do a lot of KST in the meridians. I find a lot of patients with subluxations caused by tooth issues. And so if you do have any tooth that has get inflamed and you feel that it's bothering you, this is a huge point of infection. This is a huge point of disruption, interference pathways, or interference field in the pathways of your nerve communication. So it is a must to take care of your teeth. Go and check, have that find out if everything is okay with your tooth. If you have a tendency to have gum diseases, and this is another indication that there is an imbalance, there is a site for inflammation to be sitting on. So pay attention on the health of your gums and teeth. I'll give some waves here. Hello. And so for the amalgams, it's very important and to be very, very careful when you have them removed. It's not everyone who can remove it. We normally send them to the patients to biodentists, and some patients, because the liver is so congested, that I advise them to wait for us to get better the liver condition, so then they can go and do the filling removed, because that releases mercury. And if your liver is already congested of toxins, and especially heavy metals, that found a lot of patients, more than you can imagine, with heavy metals issues in the body. So if you're not able to deal with the heavy metals, then it's better don't remove the filling until you kind of get better, detox your lymphatic system, and then you have a proper biodentist doing the removal with the proper vacuum and sucking machine, where making sure that the powder of the mercury doesn't go into your system. So the root canal, the amalgam filling, is one of the interference fields that can be stopping you from getting a better health. Another thing is, as I have been talking to you guys before, is scars. It's unbelievable, and I have thousands of stories to talk and to tell you about how scars can create a big mess into our system. And I remember I was 18 years old when at the university we start talking about scars, and I remember my professor telling me that my scar was actually creating a rotation into my spine, kind of giving me a scoliosis. Yes, I can see here a message about C-section. I'm going to mention the C-section in a minute, because that we have to work on C-sections, and actually we have to work in all of these scars. A scar is a trauma, and doesn't matter if you're surgery or if you just broke, if you just had a scar from a broken glass that you hurt you. A scar is a scar, and we have to have a quick and close look. Scars from burning, this week I saw a patient with a burning foot, and it's a severe burn, and it can create a lot of dysfunction on the feet articulation when the skin cannot slide properly. And so for me, I had a plastic surgery done on my scar just because it was so attached and with so much keloid that at 21 years old I decided to have a plastic surgery done by someone who understands about scars, and then work on my scar. And it made a huge difference, and since then I love working with scars, and I tell everyone, and I'm so happy that more plastic surgeons and dermatologists and actually overall surgeons are finding out that it is important. You know, our post-knee surgeries are so important that we release that scar, we allow the gland to come back. So as you ask about C-section scars, I think I had mentioned here in other videos, but I'm going to repeat to you guys because that story never comes out of my mind. I had a patient who came to me with a severe lower back pain for ages. She's been suffering. She had two C-sections, and the first one was not good, and the second one was worse because they put on top of the one that was already not good. So, and she never worked on. Like in Brazil and France is a demanding, like every woman after delivery, doesn't matter if it's a C-section or if it was a natural delivery, you have to have a postnatal physiotherapy. So this lady hasn't done anything, and she's been in so many years of pain, of lower back pain, and I'm treating her, and I can just feel the pull calling me in the front of her pelvis. And I said, can I check on your C-section? And it was immediately when I started working on her C-section scar, this woman went into tears, and she cried and cried and cried so much. And that leads to another interferential field that I'm going to be talking about, which is emotions. And we hold so much emotions into our scars. It's unbelievable. Like loads of the scars tell a history, like tells all the story, that the traumas and things that you have been through. So we need to work, and even if you don't go to a professional, which it will be ideally, please try to work yourself on your C-section. Try to like literally massage and go along the spine, do circular movements, up and down, trying to pinch. We should be able to kind of lift our skin, you know, and differentiate from the muscles and stuff. So if you see here, we can pull our skin, and that it should be how it is on your scar. You should be able to lift your scar and move your scar around in all of the points of your scar. If anything is attached, it will create a pull. So if you imagine here, I pull this and I try to move, I have already a restriction. Imagine C-section scar that has layers and layers and layers. So please work on your scar. So another thing that causes a lot of issues is the microbiome that everyone is talking about, and it's basically your gut. So you know, like I have a saying that normally doctors, yeah, I know you hate touching it, I know, and everyone says like, I hate touching my scar, I don't like to go near there, but it's so important, and you have to be mentally talking to yourself and say, I accept. This is it's a beautiful scar. Your son came out of there, basically, you know. So you have to treat with love. You have to talk to your scar. You have to massage and tell your body that it's fine and it's okay to get touch in there, and it's okay to release and to that get better. You have to go through it. I know it's very tough on the beginning, but you must do it. Okay. So for the microbiome of body, so basically our gut, they have a saying that the gut is our second brain, and I tell everyone who has never had any issues with the gut that to me, who had the gallbladder removed at 10 years old, your gut is your first brain. Because if you have a patient who is actually not digesting well, heartburns, and you name it, either constipation or diarrhea, you ask them if they can think. First thing they come telling me, like, I have a foggy brain, I forget everything, I'm reading my book, but I cannot understand what it's saying, that I cannot keep anything into my mind. And that tells me a lot. and that tells me that the gut is not perfectly well. We have 1,000 and trillions of living bacteria and viruses living in our gut, and it's very important that they live with harmony. They need to be there, like we have to have it, but we have the good and the bad ones, and so that's why probiotic taking is good, especially the live probiotics, the one that you buy that stays on the fridge. But the gut will tell a lot of how your brain will behave. So people who has been a lot into antibiotics, and unfortunately nowadays doctors give antibiotic for any little flu you have, any little pain you have, like, oh, this is a virus, this is a bacteria, I'll take antibiotic, and you take so much antibiotic that you end up killing the good flora of your intestines, and then end up to having leak gut and the chronic pain. And so patients are with lower back pain. I'm trying to heal my lower back pain, and I cannot. And so we go back, check the gut, and ta-da, a lot of inflammation, a lot of issues on the lower back. Don't forget that our nerves, so we have our spine, and the nerves comes out of it. And as the nerve comes out, it feeds everything. So each organ of ourselves, it's fed by a nerve that comes from our spine, as well, of course, the vagus nerve that has directly connection to the gut. But it's saying that it's super important to take good probiotics, avoid sugar. Sugar is a killer. Sugar feeds the bad bacteria, the bad virus, and sugar will end up leading to toxins that will cause a serotonin, the feeling good hormone, and so many other things. It will feed insulin, and insulin through the HMP shunts. I'm not going to get into physiology, but that's feeds cancer. So sugar is like a poison thing that we really have to avoid as much as we can, and be careful with the natural sugars, because despite of them being natural, they still being sugar. So pay attention on it. So what else I have to tell you here? I talk trauma. Okay, we have we have some emotional connects big time to trauma, and I've been speaking about emotions here, and you can tell the butterfly effects into your belly, or when you see a car and you're crossing the street and you're not expecting that. We call the panic pattern in the KST, that leads your sternum to come forward, and that will create disruptive pathways. So that will create communications cutting down into our nerve system, and these needs to be addressed. So always ask yourself, if you need, ask some psychologist, life coach, someone that you can talk about it, but let everything out and work on your past traumas or anxiety. Like, remember I said anxiety is the fear of the future, and depression is not being able to deal with the past. So let's deal with our emotions. Let's take good care of our mouth health, like our teeth, our gums. Everything needs to be looking carefully to it. Have a look on the scars of your body. Pay attention to them, give love to them, massage them. If you don't know what you're doing, anything you do, your intuition will tell you what to do. Look for focal infections. If you have something that it's been chronic, ankle sprain can cause chronic inflammation. It can cause chronic illness. If the ankle sprain was not treated and it's always there, and you know it's there, it's been a month and a half that you're walking, limping, that can cause a massive disruption into your nerve system. Always look at the nerve system as a big box of electrical cables, and if one little cable is sparkling and it's kind of firing, it's not doing well, and it can create a massive imbalance into your body. So I think I said a lot today, as usual. I love talking and there is so much content, but otherwise the videos will become very, very big and no one may not have patience to watch everything. So I hope you like it, and please keep sending messages and things that you guys would like to hear more about it. And if you're happy with the content, if you want more, I'm very happy to share. It's just so much things into my brain and I want to let everything out, but I'm really planning and trying to do everything with structure. So thank you for watching. Thank you all, and I'll see you soon. Bye for now.